In order to understand the scapular region and the superficial back, it is very important to first of all take a look at the structure and the bony landmarks, specifically talking about the scapula, which is actually the basis for all of the things that we're going to identify in the next sections. So in this section, talking about the structure and the bony landmarks, we're going to take a look at the important structures or the important bony landmarks in the scapula, including the angles and borders of the scapula, as well as the acromion process and the coracoid process of the scapula, and the spine of the scapula and the glenoid fossa as well. So here in this picture, we can see that this is actually the thoracic spine, and with the thoracic spine, we have the ribs, and the scapula is actually resting on the ribs and is actually connected to the trunk via the clavicle, and it is actually forming a functional joint with the ribs or the thorax region. I said the word functional joint because these are not actually, the two bony surfaces are not joined together as in an anatomical joint, which has for example a concave bony partner articulating with a convex bony partner, or two corresponding joint surfaces articulating with each other. And there is no such thing in this because there are actually soft tissues in between them, such as the subscapularis muscle as well. But however, it does move or slide on top of the thorax, so that is why we term it as a functional joint, also known as the scapulo-thoracic articulation. So talking about the scapular structure, scapula is a triangular shaped bone located superficially on the posterior or the dorsal aspect of the thorax. It attaches to the trunk via the ligamentous attachment to the clavicle, as you already mentioned, and it is slightly concave anteriorly or ventrally, and that is because it actually sits on the thorax. And if we take a look at the thorax posteriorly, you would see that the thorax is, or the shape of the ribs and the overall the thoracic region is convex. So to fit on the convex surface of the thorax, the scapular ventral surface needs to be concave in the ventral orientation, and that makes it fit snugly or in a better way over the thorax and helps it to glide over the convex posterior rib cage or the thorax. Now, the word that we use as the shoulder girdle is actually different from the shoulder joint, and the shoulder girdle is actually formed by the scapula and the clavicle. It is somewhat similar to the pelvic girdle, which is formed by the three innominate bones when we talk about the lower extremities. Many muscles also connect scapula to the trunk, including the serratus anterior and the subscapularis, which we are going to talk about in the upcoming sections. Now, talking about the individual bony landmarks of the scapula, let's start off with the angles. So we have two angles, or in one way or the other we can also say three angles. So the two angles are actually the superior angle and the inferior angle. If we talk about the glenoid fossa, we can also term it as the lateral angle, but because it actually makes a joint with the humerus forming the glenohumeral joint, so it is actually named as glenoid fossa or the glenoid cavity. So we have the superior angle, the inferior angle, and the glenoid cavity on all the extremes of this triangle. So superior medial aspect, as you can see, this is superior, but it's also medial. This is where actually your spine is. So this is medial. So superior medial aspect providing attachment for the levator scapulae muscle, which is responsible for the elevation of the scapula. Then we have the inferior angle. So it is the most inferior part of the scapula, and this is where the vertebral and axillary borders meet. So this one here on the medial side is the vertebral border, and this one on the lateral side is the axillary border, and they both meet at the inferior angle. This point determines scapular rotation, because if the inferior angle moves upward, then this is known as upward rotation. And if we talk about the backward movement, or when the inferior angle comes back to its neutral state or it comes back downwards, then it is known as downward rotation. So it is of remarkable significance because it allows you to know about the orientation or rotation of the scapula in terms of upward or downward rotation. Moving on, as you already mentioned, the vertebral border and the axillary border. So this is the superior border, this is the medial border, and this is the lateral border. The medial border is also known as the vertebral border, and the lateral border is also known as the axillary border. So vertebral border is between the superior and inferior angles, as you can see, the superior angle and the inferior angle. And it also serves as the attachment site for the rhomboid muscles and the serratus anterior. Moreover, talking about the lateral border, the axillary border, it is located on the lateral side between the glenoid fossa or the glenoid cavity and the inferior angle. One another important structure is the spine. Spine is actually the projection on the posterior surface running from medial border laterally to the acromion process. So as you can see, this is actually the dorsal aspect of the scapula, and this one is the medial or the vertebral border. So it runs from the medial aspect towards the lateral aspect and forms a structure known as the acromion, also known as the acromion process. This also divides the dorsal aspect of the scapula into two regions. One is the supraspinous region or the supraspinous fossa, and one is the infraspinous region or the infraspinous fossa. And the supraspinous fossa is actually the site of the origin of the supraspinatus muscle, and the infraspinous fossa is actually site of origin of the infraspinatus muscle. Moreover, it also provides attachment site for the middle and the lower fibers of the trapezius muscle. Another important structure here is the glenoid fossa, sometimes also referred to as the lateral angle of the scapula. And it is slightly concave, and because it articulates with the convex humeral head and forms the glenohumeral joint, and on the superolateral side above the axillary border and below the acromion process. So this one is the lateral or the axillary border, and this one is the acromion process. So this glenoid fossa or glenoid cavity is actually located between the two. Now moving on, talking about the coracoid process, it's one of the two major processes of the scapula. One is the acromion process and one is the coracoid process. So it is actually the projection on the anterior surface or the ventral surface of the scapula, providing attachment for the pectoralis minor, which serves as a muscle which is responsible for depression and protraction of the scapula. Talking about the acromion process is another important process, which is broad and flat area on the superolateral aspect just above the glenoid fossa, and it provides attachment site for upper trapezius muscle and also one of the heads of the biceps brachii. So that was all about the bony landmarks of the scapular region and the subscapular region, the superficial back, specifically talking about the scapula. And I hope you learned something new out of it, which will help for our basics for understanding the next sections. And thank you very much, and keep on watching sqadia.com.